Mute. What is happening?
Not coming down to do. Yeah. Putting a blood on. Maybe starting.
Mute. Dr. Dale?
Hello.
Good morning, doctor.
Hi, good morning. Can you hear me? Hello.
Yeah, I think it's the volume is a little low, doctor.
Now is it better?
Yeah, we
Dr.
can hear
Giselle?
him. I can hear
Yeah.
him. I can hear him well.
It's okay?
Yeah.
Okay. So should we start?
Yes, you'll have to help me just share this screen of mine.
I'll start.
Yes. Sharon, should we start?
Shall we start?
Dr. Cheryl, I think we'll start.
Dr. Cheryl?
Is my screen visible?
Doctor,
Slide
my
show.
screen is on. So as soon as she finishes the introduction, I will give you access to the screen.
Okay, okay.
Hello, good morning. Can you all hear me?
Yes, doctor.
Can I start? Or we wait?
I think you can start in 2 minutes. Dr.
Okay,
Cheryl,
sure.
give me
Yeah,
2 minutes.
yeah.
हाथ नहीं किधर
Dr. Cheryl, you can start.
Good morning, everyone. Thank you for giving us thank you for giving us your Sunday morning. I can see nice, bright, sun-shining faces. So we appreciate that. I am Dr. Cheryl D'Souza, part of the core team of the Health Outreach. I would like to brief you a little bit about the Health Outreach before we start today. Our Health Outreach is an initiative which was started in 2020 under the leadership of Bishop Alvin De Silva and a very energetic group of doctors. Here today is Dr. Nicholas Santao, there's Dr. Armida Fernandez, Dr. Giselle Pace, myself, Dr. Cedric Moraes, Dr. Odette Gomes, Dr. Lira Fernandez, and we've got few non-medicos too on our team, Sharon, Milton, who support us. So Health Outreach started as a very short-term project in COVID where we reached out to help the poor. And helping the poor, we were so satisfied and so were the poor, so we decided not to stop it, and it's still growing. We're catering to the poor and vulnerable. We work out of 35 odd parishes and hand-holding them to the poorest of the poor to get their medical treatment. We arrange for teleconsults, discounted diagnostics, and dialysis. Free medicines are given to us. And we've got 30 plus doctors on our panel who really reach out to the poor. All this can only happen with our collaboration with different organizations like the Bombay Catholic Sabha, Health Promotion Trust, Vision Rescue, Dr. I Institute, Prison Ministry, many others, and our most helpful one, Wallace Pharmaceuticals, who provides free medicines for all our beneficiaries. Health Outreach cares not just for the poor, it even cares for people like you, mind, body, and soul. So apart from reaching out, we like to inspire you educationally through webinars like we have one today. I would like to now introduce our moderator who will take you through a very educational session today. Our moderator today, Dr. Nicholas Santao, is currently an orthopedic surgeon, one of the best we have in town in Holy Spirit. He's the head of the department, practicing for more than 40 years at the hospital. Doctor is currently managing trustee and executive director of FIAM Biomedical Ethics. Dr. Antha was past president of Bombay Orthopedic Society, Indian Arthroscopy Society, and Indian Federation of Medical, as well as an editor of many journals of orthopedics. He has done and continues to do community service and has received the Lifetime Achievement Award by the Catholic Medical Guild for honorary services. This doctor really works with his heart and reaches out to the poor. We are proud to have him in our midst. Dr. Antao, I hand the floor over to you. Thank you.
Thank you, Cheryl. You have said so much about me, which I don't know. And on behalf of His Lordship, Bishop Alvin De Silva and Dr. Armida, I welcome you for this, and the co-members of the Health Outreach. I welcome you for this webinar. This Dr. Armida had asked me to organize this webinar. That's why I'm here. And first thing that struck me was to contact my good friend, Dr. Dale, to talk about this topic. The topic is strategies in cancer prevention. Well, the meaning of cancer, or the word cancer itself, always frightens us and frightens everybody. not only the patient for suffering, but the caretakers involved in looking after their dear one or their friend. And what is it and why is it that the rates of cancers are increasing? In a family, you find lots of siblings having this. In the hospital, you find a lot of staff having cancer issues, and so on and so forth. It runs in generations. So genetic factor is one of the factor which I suppose we cannot prevent. But there are strategies where you can do something about this. But the most important risk factors that are involved is the IV ultraviolet radiation, People go to beaches and do a lot of tanning. Those who are overweight and very obese, those who are addicted to alcohol, and those who are frequent smokers. That also give rise to some issues in getting cancer and certain food habits. Not only the men and women are involved in this, but also children in the ratio of boys to girls, 30 to 25. It's ever increasing scenario. Before taking much of the time of the speaker, I now would like to introduce my eminent speaker, Dr. Dale Rodrigues, who will talk on this subject. He is a surgical oncologist trained from Tata, and he is attached to Holy Spirit Hospital, Holy Family Hospital, Hinduja Hospital. But the most important part of his is he has been trained by the famous, internationally famous Dr. Anil Pradhan, who is his mentor, and he has developed all the qualities of Dr. Pradhan, the hard work. He is there everywhere, never says no, and operating the amount of talent that he have, skillful operator, and also a patient doctor and compassionate doctor. Before taking a lot of his time, I now would like to ask Dr. Dale to take over his talk. Dr. Dale?
Hi, good morning, sir. Thank you for those kind words. Good morning to everyone. Is my screen visible to everyone? We'll start off with the presentation. Dr. Giselle,
Yes, doctor.
is my screen visible to everyone?
Yes.
The
Yeah,
PowerPoint?
Go ahead.
Go ahead.
All right, so today we'll be talking on cancer prevention. Basically, how can we do things to prevent occurrence of cancer? So the magnitude of the problem we'll talk about first is the estimated number of incident cases of cancer in India for last year, 2022, was found to be 14 lakh cases. In 1 year, we have detected 14 lakh cases, 61,000 plus cases. In India, the calculation goes as 1 in 9 people will develop cancer in his or her lifetime. So if you catch 9 people randomly, one of them definitely is going to get cancer. The incidence is continuing to increase in India. New estimates will be helpful in planning cancer prevention and controlling them. For intervention of early detection, risk reduction, and management. So our aim of this talk is to have activities which will detect these cancers probably in early stages, reduce the risk of you getting a cancer, and in short, we'll be discussing how to manage them as well. So the most important factor or risk factor is tobacco consumption in cancer. Tobacco is the most important identified cause of cancer, responsible for about 40 to 50% of the cancers in men and about 20% in women. It has resulted in a huge burden of oral cancers and oral precancerous lesions. Beside oral cancers, tobacco also causes various other cancers like lung cancer, stomach cancer, urinary bladder cancer, and n number of cancers. So tobacco is the most important risk factor. So when I'm talking about risk factors in cancer prevention, I'm only talking about factors which we can modify in our life, which we can take out from our life, or which we can alter in our life. I'm not going to talk about the factors which are unavoidable. Those are the factors which are something like genetics. We cannot alter genetics, but these are modifiable risk factors which we have, which we can alter in our lives. So in India, the states with the highest percentage of tobacco consumption is the northeastern state, Mizoram, Manipur, where you have a high burden of cancer cases, oral cancer cases coming from there. So 72% of cases are from the northeast, 50 to 70%. There are about 267 million cases tobacco users in India. 14.2% tobacco use prevalence is significantly higher among women, among men, 42% in men and 14.2% in women. So when you talk about tobacco, everyone thinks about people smoking cigarettes. So it's not only that, it's what we call as a smoking form and a non-smoking form. So cigarettes, BD, cigars, these are the smoking forms of tobacco. But there are also the other forms of tobacco, which are the chewing tobacco, snuff, where these are smokeless forms of tobacco, which also are dangerous. All forms of tobacco, all products of tobacco are dangerous. They have high carcinogens in them. The second factor is diet, and diet can be modified. So this is the thing that we need to talk about. Diet that may be causing cancer, So there's no proven factor where a diet is causing cancer, but these are the things which are noted down where we can modify it in our lifestyle. So everyone likes this picture of a burger, the ring onions and the French fries and the pizzas and all the fried stuff. But these are the foods which have a high animal fat and animal proteins, where it is directly correlating to the high risk of cancer cases. So in India, dietary habits may be responsible for only about 10 to 20% of the cases. Diet takes a special importance in countries like India because we are fast moving towards industrialization and westernization, like KFC, McDonald's, fast foods, Burger King. These are all the foods which taste nice, look nice, but they're not good for the body. We'll look into individual cancer treatable factors or risk factors. So first one is cancer of the head and neck. Head and neck cancers are basically tongue cancers, cheek cancers, anything in the oral cavity to do. So the main risk factors for these cancers are tobacco and alcohol, as we have already discussed. A diet rich in green and yellow vegetables has been shown to offer protection against oral cancers. Avoidance of tobacco and alcohol is the most important preventive action against mouth, throat, and lung cancers. Cancer of the oral cavity can be detected early, precancerous conditions or cancers. So head and neck cancer basically is examinable cancer, means you can look at the oral cavity and see whether there is a cancer. There are other cancers which are stomach cancer, colon cancer, where you can't, it's inside the abdomen. So it's very difficult to diagnose these on an early stage basis. But head and neck cancer, it's visible through the oral cavity and can be seen, and it can be detected in early cases. Cancer of the stomach. So if you can see in the picture, just about the anatomy, is the food pipe that is called the esophagus, which opens up into the stomach. And then the stomach goes down into the small intestine, that is the duodenum, jejunum, ileum. So esophagus and stomach per se, consumption of large amounts of red chilies, spicy food at very high temperatures, and alcohol consumption are the main risk factors for stomach cancer in India. In Japan, the foods which are processed or canned foods, or the dried foods, or those pickles, these are the ones which cause stomach cancer. Consumption of tobacco extract, that is tubur, has been linked to high rates of stomach cancer in Mizoram. So this is another form of smokeless tobacco, which high rates of stomach cancer in the Mizoram, which of smokeless tobacco consumption, that is tubur. Colon cancer or the large bowel cancer. So colon cancer is basically directly linked to heavy consumption of red meats, which can lead to colon cancer. White meat such as poultry, that is chicken, fish, do not have any risk associated with colon cancer. There is an international correlation between red meat and large bowel cancer. So red meat is a risk factor for colon cancer. Breast cancer is most common cancer nowadays, which we see. Breast cancer and head and neck cancer are the two most common cancers which we are seeing. So we must talk about breast cancer, how we can modify our habits. So breast cancer is emerging as the leading cancer in women. Number of factors: late age at first pregnancy. That is, if the first pregnancy of a woman is after the age of 30 years, they have a higher risk of developing breast cancer. Late age at menopause or early age at menarche, starting of your menstrual periods, is also considered high risk factors for breast cancer. Again, menopause age is not at all a modifiable risk factor, but your first pregnancy age is a modifiable risk factor. High fat in the diet. So it's moving too fast. High fat in diet is also associated as a risk factor. Physical activity is found to be protective for breast cancer. So more physical activity is better for breast cancer. Rather, most of the cancers, if you have a physical activity like an exercise schedule in your day-to-day life, is better. A regular breast self-examination by women themselves is a very good way of detecting breast cancer in early stages. What is breast self-examination? Is a simple method which helps to detect breast cancers. It can be done at home by any woman. Many ways of doing it. I think Google is the best way to just look up breast self-examination. It's a big topic to talk about breast self-examination, but if someone wants to know about it, we can do it. Do that as well. Detecting a cancer when it is in the very early stage can improve cure rate. So the idea behind doing these talks, doing this breast self-examination, telling you what to eat, what not to eat, is to reduce the risk. And also, if you develop a cancer, you should be detected in the very early stage where you may not need anything, just surgery and no chemo, no radiation. Cervix cancer, which is nothing but the lower part of the uterus, again a very common cancer. So the risk factors for this are the early age at first intercourse, multiple sexual partners, poor sexual hygiene, and some of the reproductive risk factors for cervical cancer. The HPV is the virus that causes this cancer. It is human papilloma virus. It is seen in women who have multiple sexual partners, have a poor sexual hygiene. Improvements in the living standards of women have resulted in a reduction in the incidence of cervical cancer. A regular cervical cytological examination, that is pap smear, by all women who have initiated sexual activity can prevent the occurrence of cervical cancer. So cervical cancer can be prevented in such a way that we do pap smears on a regular basis for women. It's an easy test done on an OPD basis. Not much equipment required, not much expertise required. So prevention and screening. So primary prevention is the most important cost-effective prevention program. What is primary prevention? It reduces the risk, reduces the incidence by reducing the by modifying the risk factor. So you modify the risk factor, then automatically you're preventing cancer. So when I say modifying the risk factors means you start by eliminating them, or something like anti-tobacco programs, where you develop programs where you encourage people not to have tobacco, not to consume tobacco. Teenage students need to be targeted, as most of them pick up these habits at that age of smoking, drinking. So teenage students should be a target group. School curricula should involve messages for a healthy lifestyle and harmful effects of tobacco and alcohol. Legislation has to be enforced for prohibiting tobacco advertisement and sale of tobacco. Often we see there are ads by big Bollywood stars for tobacco and tobacco products. So these should not be encouraged, and it sends a very bad note to the younger generation. Importance of a healthy diet rich in green and yellow vegetables and fruits has to be highlighted. Cancer of the uterine cervix can be controlled to a certain extent by practicing genital hygiene and safe sexual practices. Mammographic screening for the breast cancer may not be cost effective in India. It's an expensive test, mammography. But regular breast self-examination needs to be promoted for early detection of breast cancer. Breast self-examination can be propagated through print and electronic media. So as I said, Google is a powerful tool, but also it is like a double-edged sword, where you may get information, but the information may confuse you even more. So use it sparingly and use it smartly. Breast self-examination is easily available on Google, multiple sites. So you can use it to your benefit to know how to do a proper breast self-examination. And as well, you can meet any staff or healthcare personnel in a hospital to help you out with it. Cancer detection and prevention clinic. So what we can do as a group is that the most common problem in India is that we get these cancers at a late stage. Means late stage at presentation is the main reason for poor survival from cancer in India. So the idea behind doing these talks is that we try to catch cancers in the early stages, where the treatment outcome becomes very good. So you have a good survival and results are better. Late presentation is mainly due to the lack of diagnostic facilities at the peripheral levels. Hospitals can have a cancer detection and prevention clinic. So even small hospitals or small setups can start cancer detection prevention clinics. We need to have this all over India, and in a city of Mumbai, we have it everywhere, but probably in the villages, we don't have these things, where we need to start these cancer detection facilities in villages and outside Mumbai. Treatment facilities, I'll just go in short over it. It's basically for different cancers, different surgeries. Some cancers, no surgery, only chemotherapy. Some cancers, no surgery, no chemotherapy, only radiation. Some cancers, a combination of 1 or 2 or 3. So it depends on what cancer is there. We won't go into the details of this. Each cancer has a different treatment strategy. A long topic to talk about each cancer. But in short, we should remember treatment early is the best, early detection is the best prevention. So earlier you're detected, the better chances of you have to survive long. Palliative care in cancer was more than 75% of cases, cancer cases in India present in advanced stages, and palliative care and pain relief are the most important factors or things to give them a good quality of life or end of life or terminal care. Halfway homes and hospices may be considered. So you have various centers like Shanti Aved now where they have terminal cancer care to give them a good quality of life. Human resource generation for detection and prevention of cancer. So cancer control programs need a large number of trained personnel like epidemiologists, statisticians, cancer registry operations, cytotechnicians, cytotechnologists. Nurses play a very important role in palliative care, in the care of cancer patients in the wards, on chemotherapy, radiotherapy, different setups, different nurses, different training for each nurse, medical personnel in all aspects of cancer treatment, physiotherapist, post-surgery, we need to give them proper physiotherapy, occupational therapists, and most important, counselors. There are patients who do not agree to the diagnosis of cancer and think that they don't have cancer in spite of having a biopsy and having a proven diagnosis of cancer. So we have counselors who will help them out. Multiple specialists who are involved in the treatment of cancer. So it's not only one doctor, it's multiple team of doctors. As I always say in to my patients, it's not only the surgeon, it's not only the chemotherapy doctor, it's not only the radiologist, it's a multiple team of people who will help you out in the post-cancer rehabilitation setting or pre-cancer rehabilitation. So a take-home message for everyone. These will be the modifiable things that we can do in our lives. And so eat fresh fruits, fresh vegetables, a good amount of fruits in your diet which are fresh. Chicken is fine, fish is fine, cereals, these are all good for having a healthy diet and preventing cancer. They have a high content of antioxidants which will help prevent cancer. Exercise every day, get a regular physical activity every day in any way. It lowers the risk of cancer. At least 150 minutes a week, about 30 minutes a day is fine, I can say. Being physically active reduces the risk of most of the cancers, and besides breast, colon, and endometrial cancers. It can improve your quality of life. It can control your weight. Physical activity may decrease the risk of liver esophageal cancers, improve survival after breast cancer. So physical activity must go out, do 30 minutes walk or do a exercise or do some exercise at home. It'll help you. It'll help prevent cancer. Needless to say, smoking is bad, should be stopped at all cost. It just breathes life into cancer, that is saying. So smoking should be stopped. Not only smoking, the other uses of tobacco, that are the smokeless forms of tobacco, there's chewing tobacco, snuff, everything should be stopped, and it should be there should be legislations put into action not to use these products. Difficult to say stop alcohol for everyone, but lessen the amount of alcohol that you take in your daily life. As much as less alcohol is better for you. Stopping alcohol is the best, obviously. I already said this before. Increase your poultry, that is chicken, in the diet. Fish is good. It has omega-3 fatty acids. Crayfish, all good for health. Should be encouraged. Reduce your red meat consumption in your life. If you normally like a hamburger or beef burger, or reduce the amount. Maybe once in a month is fine. Or maybe you replace it with something with chicken or fish. Basically, the idea is to reduce your red meat consumption. For breast cancer, reducible risk factors are have kids early, that is before the age, at least your first child bearing should be before the age of 30 years. Beyond 30 years, you have a higher risk of developing breast cancer. Maintain a healthy weight. Healthy weight, when I say the easiest way to calculate your weight, healthy weight would be your height in centimeters minus 100. So if I'm 5'6", so I'm about 165 centimeters in height. So minus 100 from it, I'm supposed to be 65 kg. So that's the easiest way to calculate your ideal weight. So keep a healthy weight, be active, kids early. Breastfeeding is very important and to prevent breast cancer. So 6 months of exclusive breastfeeding is recommended by all breastfeeding specialists. Eat well, try not to take any stress, don't smoke, avoid long-term use of hormone replacement therapy. Those are contraceptive pills or hormone replacement therapy. These are going to cause problems in the long run. So any use of more than 3 years is the cutoff where we say that you have a high risk of breast cancer. Prevention of cervical cancer. So avoid promiscuous sexual activity, multiple sexual partners, avoid use condoms or contraceptives during sex to prevent transmission of the human papilloma virus and other infections. Quit smoking and vaccination against cervical cancer. So cervical cancer is the only cancer which has got a vaccine to prevent it and should be given to all the age groups. So I have a small slide on the vaccines as well. Two vaccines are the Rodrigues and Gardasil, but it is given to the age group before the attainment of sexual activity. So Cervarix is given between the age group of 9 to 15 years. So you may have dose 1, dose 2 up to dose 3. Between the two, both are good. One has a number of viruses types covered, but both are frequently given. But the age group is before the age of 15 years, before the age you attain a sexual activity. Thank you, everyone. We'll take questions.
Thank you, Dr. Dale, for such a lovely presentation and deliberation.
Yeah, welcome. If there's any questions, we can take it.
Yeah, you talked tobacco. What about the pan and the electronic cigarettes?
Electronic cigarettes also come under the smoking form of tobacco. So yes, they are also included. I'm sorry I missed that out. And pan and yes, betel nut. Yeah, that's the most common things used by the people of oral cancer. They also cause oral submucosal fibrosis. Betel nut is the main thing. Areca nut, which causes oral submucosal fibrosis. The supari that we see.
Some of the men here would like to know more about the lung cancer and prostate cancer. How is there any way to prevent prostate cancer?
Prostate cancer basically is hormone dependent cancer. There are no preventive factors for prostate cancer. Once you develop it, it's either surgery or depends on what stage you're at. If it's stage 1, 2, then we operate or radiate. If it's stage 3, 4, then we plan on giving hormonal blockade agents. But there's no prevention as such for a prostate cancer.
What about excess coffee?
Excess coffee. Excess coffee, not a very known risk factor. What they say is tea, which is very hot, or piping hot, is a known risk factor to cause esophageal cancers. So it burns the mucosa while the tea is going down your throat. It's actually burning your lining of the food pipe, that is the esophagus, which is a direct correlation for esophageal cancers. So piping hot, rather than tea is the most common drink had in India. So piping hot tea is one of the risk factors for esophageal cancers.
Dr. Dale, is there any
Also-
way that we can find out early method of prostate cancer?
Early method is you will have to.
Any indications or something like that for men? And normally, does it come above after 40 or 50 years, or which year normally?
Normally, the routine prostate cancers occur after the age of 60, more in the elderly age group. But if they occur below that age group, then they are considered as aggressive cancers. There is no way of preventing a prostate cancer. That's why we do screening with the blood test, that is a prostate specific antigen. We do PSA levels and we do regular health checkups for men who would like to know about prostate cancer. And you can do a sonography, but there is no way of preventing that cancer. If it has to happen, it will happen.
Dr. Dale, since we are on the prostate cancer, lot of the priests and all have prostate cancer compared to married people. Is there any correlation or something to do? Is there any correlation also of masturbation to prostate cancer?
Not that I know of. And equal number of people besides priest also have prostate cancers. Whereas if you see breast cancer, it is more common in the nuns because it is.
What is the reason?
Because it is a hormone dependent cancer and there are more number of cycles. Nuns do not get pregnant. They are exposed to more number of their periods cycles, estrogen, progesterone cycles, which have an effect on the breast, and this causes breast cancer. But when you see prostate cancer, there is no actually definite identifiable factor which has been documented for masturbation in prostate cancer.
Okay, since you are here, you said multiple partners
Yes.
can give rise to one of the risk factors. What about multipara? Is there any relationship between the two?
So I had done a research
Many pregnancies.
on the risk factors for cervical cancer, where one of the documents said that multiple pregnancies may cause cervix cancer, but there's no evidence for that. So I just deleted it from the slideshow because it would confuse people even more. Multipara is not a risk factor for cervix cancer. In fact, it is protective for breast cancer. Multiple pregnancies will protect you from breast cancer, because the time period that you are pregnant, that many number of cycles, that is your menstrual cycles, are reduced. Your estrogen levels are all under control. It's not acting on the breast, so it's protective. And repeated pregnancies, you'll have to breastfeed your babies, so that is again protective.
Uh, I read an article where they said those people who abort, they have more chances of breast cancer. Your comments on that?
Multiple abortions, yes, is a known factor for breast cancer. Multiple abortions is a known factor, yes. I agree with you.
Yeah.
But
Now,
only for breast,
I'm in the
not for.
Doctor, is there any blood test you can take to detect blood cancer? Any blood test for any cancer to detect any cancer?
Most of the cancers have a blood test. Most of the cancers. Breast cancer is CA 15-3. Ovarian cancer is CA 125. Colon cancer is CEA. Hepatobiliary cancers are CA 19-9. But there are few who don't have any markers, like lung cancer. They don't have a marker.
Okay. Thank you.
since there are so many markers there in that study of the genetics, a lot of people opt to remove the breast or remove the uterus, like the BRCA positive people. What is your say on that? Is it ethical, non-ethical?
Removal of the breast depends on multiple factors. Depends on where the lump is. There are single lump, multiple lumps, microcalcifications on mammography.
No, as a prevention, as a prevention.
As a prevention means before you develop cancer?
Yes. I mean, suppose say there are two ladies. Her mother had cancer, so she does BRCA positive for the daughter. She has positive, so she's afraid she might get cancer, and she removes her breast, like the famous celebrity who has done it in America.
Yes. So Angelina is the one who did it.
Angelina.
So this is something known as prophylactic risk reduction surgeries. Prophylactic risk reduction surgeries, where we do complete removal of the breast or removal of the ovaries if they are hormone positive, to prevent, especially for BRCA1 and BRCA2. These are the genes, two known genes in breast cancer, where they're known to get breast cancer and ovarian cancer. So bilateral removal of the breast, bilateral removal of the ovaries. These are risk reduction surgeries. Of course, it is you have to take the proper consents from them. Ethically and medically, two difficult questions to answer. But medically, if something can prevent cancer, so BRCA1, BRCA2 has a very high percentage of 45 to 75% chances of that person developing a cancer after 35 years of age, 35 to 60 years of age. So usually these surgeries are recommended after they have completed their families, say by the age of 30 to 35. But yes,
Okay,
it's being done.
Yeah. About the foods, you nicely mentioned about the foods and all with a lovely attractive diagram. Among the foods, meats, beef, cheese, mutton, and lamb. What is the best food? And fried or boiled or half boiled, half done. What will you say about that? Like a steak.
Red meats, try to avoid as much as possible. Once a month or twice a month is fine. All red meats, that is beef, mutton, lamb. These are all pork. These all come under red meats. Some people say pork is white meat, but I disagree. Meat is meat. Chicken comes under white meat, that is good for health. Fish comes under white meat, that is good for health. Eggs, when you say eggs are good for health, you should have it. Any fried food is bad. Try to reduce the fried food, try to reduce the oil in your diet, try to reduce your cholesterol levels. These will help you in the long run. Otherwise, one egg a day is fine.
Doctor, excuse me, I have a query. Am I audible?
Yes,
Yes,
yeah.
very much.
Doctor, regarding this chicken, they are injected. So is it safe to consume them?
Many theories there, no way to prove it. We have to have faith somewhere, and we have to
No,
start
between
somewhere.
poultry, County chicken and the poultry chicken.
Of course,
Yes,
yeah,
the
Because
Gaudi
poultry
chicken is
chickens are
Gaudi chicken
injected,
is
no?
ingrown, so you know what
Yeah.
you have given to the chicken. But these packed foods, what come in Godrej or your Venki's, difficult to say whether they are given steroids or given some medicines to increase.
it's royal food.
There are many people who will send WhatsApp videos of things being injected, but I don't know how true they are, and there's no way of knowing it out as well. You have to just have faith in and just consume.
What
Uh,
about the veggies and fruits also with pesticides and insecticides?
Wash well.
Yes.
Yeah, because they have
Everything will
a
have something or the other.
they have a 3-layer treatment of washing in hotels, big time hotels. So that kind of a process has to be, you can check on the internet on this. Well, being an orthopedic surgeon, I'm quite interested in a lot of women in the after 50s. They want to remain younger and they go on to HRT, hormone therapy. Is there any relation to cancer for this?
Yes, there's a direct correlation. HRT has a direct correlation with breast cancer. So if you're giving hormone replacement, just calcium is fine, but if you're giving hormone replacement, that is estrogen, to increase the bone strength, it's definitely going to be bad in the long run.
As parents, what would you advise your children regarding the cancer prevention?
As parents, my own child is a fan of KFC, so I'll try to reduce. We have to just advise them to reduce whatever these fast foods are. Try to have home cooked food, lessen the oil, do a regular exercise. Doing exercise every day is something which is considered as a
झालं माझं?
we need to
Toast बनवलं?
we need to find out at least a 30 minutes to 1 hour for ourselves for doing regular exercise. That's going to help in the long run.
Sharon, can you check the questions on the chat box, please?
Yes, Dr. Giselle is going to take it up. Dr. Giselle?
All right. Dr. Giselle Face, please come in.
Does calcium get reduced in the cancer treatments?
Does calcium reduce? It doesn't reduce per se, but there are some medicines in breast cancer where we give hormonal therapy, that is letrozole, anastrozole, where those medicines have a side effect of reducing the calcium in your bones. So that's when we replace calcium with calcium tablets, but there's no other way of there's no other known factor which causes reducing calcium.
Okay, and does testis infection cause cancer?
No, testis infection do not cause cancer.
Cheese is also a processed food, right?
Cheese is fine. Cheese is fine. It's not a known documented risk factor. Cheese is fine. When I say processed foods, means processed meats, sausages, salamis. These are the processed foods where they mix a lot of unwanted stuff in them and they make it tasty and give it to you on the platter.
There is high incidence of brain tumor, gliomas, recurrent cancers. There are modern technology machines which cause which are used for non-invasive radiation. Could you throw some light on this?
For brain cancer per se, see, brain cancer I don't deal with. It's dealt by the neurosurgeons. But brain tumors are treated with mostly radiation. Surgery, if can be done, should be done to remove the tumor. It depends also on the size of the tumor. It's a very large tumor, then definitely surgery is not going to help. It's going to be only radiation. And if it's a small tumor, you have something known as cyber knife nowadays, which cyber knife targets it very well. And there's much less radiation beams given to the normal part of the brain. So you target it on the tumor only.
Does IVF or assisted methods of pregnancy increase the risk of cancer in women with multiple miscarriage histories?
Yes, very much. It has a very high risk of, is one of the known risk factors for developing breast cancer.
That's
So
because a lot of
again,
hormones are.
yes. So again, IVF is again your hormonal changes. So tablets or injections are given to change the hormonal cycles. You're exposed to a number of estrogens. Again, repeated IVF failures are also known factors for breast cancer.
Can you add a comment here since we are in the artificial reproductive methods? Surrogacy.
Surrogacy is
because you take away the child, the breasts are swollen up, the fat is big, and suddenly I don't know how the hormone is circulating, prolactin. What happens to that? Is that to do anything to breast cancer?
You mean in the surrogate mother?
Yes.
It will be protective for her. It will be she's getting pregnant, and if she is breastfeeding the child or
no
not
surrogacy, they
breastfeeding
don't
the child.
breastfeed.
Difficult to say that there's no known documented evidence for that.
Lifestyle.
See, go ahead.
Yeah, doctor, you go ahead. I'm moving to the next.
In India, there is a lot of Ayurveda medicine being prescribed, and a lot of this Ayurveda specialists, they talk about roots and powders for prevention. Your comments on that, please.
See, Ayurveda, homeopathy, we are allopathic doctors, so we don't know much about it. I don't like commenting on things which I have not read about, but then they don't do any help. Many patients of cancer in the early stages have gone for Ayurvedic, homeopathic, and they come back to us with a 4th stage cancer. Then we cannot do anything. So Ayurvedic and homeopathic for cancer is a strict no-no. But once you're treated by allopathy, that is the surgery, chemotherapy, radiation for cancer, there is a Ayurvedic alternative which we give, which is a form of turmeric that is known as curcumin, where we give it to the patients, and that has some evidence, some evidence that it will prevent a recurrence. But of course, we have seen recurrences in spite of giving that. But it's quite rampant being given. It is curcumin derivative or turmeric derivative, which is being given to patients. But for primary treatment, strict no for Ayurvedic and homeopathic.
There's some.
Which foods come under red meat? I think you also already. Yes, doctor.
There's a question on microwave.
There are many questions. Yeah. I'll just complete the initial questions and then I'll go down to the newer ones. There are so many which have gone by. Yeah.
Right.
So which foods come under red meat? Doctor already answered this. Does pork come in that? Because beef and mutton definitely. So I think you already answered saying that pork is also red meat, right?
Yes. Consider it as red meat because there's a lot of fat in it.
Yeah. Also, lifestyle, daily usage of hair straighteners, facial makeup, could these also cause cancer?
Facial makeup.
Hair color.
Any chemical is bad for you, so try to reduce it.
Somebody's asked fresh pan from the tree and rose tea, light tea. Is that also bad?
Rose tea, light and all is fine. Green tea, rose tea, these are all light, anything light is fine. But pan is not good at all. Any pan, fresh pan, right pan, anything is not good. Anything to do with pan is not. Pan basically must be asking
Since-
about areca nut.
Yeah.
The
Betel nut is completely
Since
no.
Yeah, can I just ask one question here, Dr. Giselle?
Yes,
Since
yes,
you talked
doctor.
about creams and all, a lot of people
Yeah.
will go to the beach and apply sun tanning cream and all, no?
Yeah,
How
sunscreen.
much you apply and how many days you apply, is that had any effect?
So those are basically to reduce the skin cancers, the sun tanning creams. But there's no direct correlation with how much you apply, when you apply.
No, when you get a skin cancer patient, the history, does it tell you this many patients were exposed to sunlight on the beach or no?
So the skin cancers per se in India are quite less.
Is there any
Skin cancers in
correlation?
India are quite less. They're more in these countries like Australia, New Zealand, where the ozone has depleted there. So you have skin cancers coming in more frequently in Australia and all those areas. But again, these sunscreen creams and sunscreen lotions, they are known to be protective against those harmful ultraviolet rays. But if you have to develop, you'll develop. There's no direct correlation of whether you apply a thick layer, thin layer, it will prevent.
So it's the ultraviolet which is causing the cancer, not the creams, right?
It's the ultraviolet rays. So in Australia, there is an area where the ozone has been depleted. The ozone layer of Earth has been depleted. So ultraviolet beams directly come into the atmosphere, and that's what causing cancer. So in India, we rarely see skin cancer. It's not that common.
Do people have?
Ozone layer is good in India.
Do people having COPD, are they at a higher risk of developing cancer because their immunity is compromised?
No, not really. COPD has no correlation with lung cancer.
Excuse me, may I ask a question?
No, COPD, what is the full form? You must.
Chronic obstructive pulmonary disease.
Dr. Dale?
Yes.
Is it
100%
necessary to have a thyroid guard when doing the mammogram?
Thyroid guard, yes. So very good point that you picked up is subclinical exposure of radiation beams to your thyroid glands. So thyroid cancers are coming up quite frequently. The problem with thyroid cancer is that it's not a problem. It's good actually that the thyroid cancer is a very slow growing cancer. So you don't get the symptoms very early. So I usually use a thyroid guard when I'm doing any extra procedures in the OT. You should always try and insist on having a thyroid guard wherever you're doing any X-ray. Not only in mammography, but even in your dental procedure, you should give your patient, or if you're the patient, you ask for a thyroid guard.
Doctors, sorry to butt in, but at Holy Spirit, when I asked for the thyroid guard, I was told that they can't do the mammogram properly then. So on the 2 occasions, they said they can't, they don't give the thyroid guard.
It's not routinely used, but since you asked it, yes, I have to say yes. It's not routinely used because the mammography X-ray also is a very, very, very tiny dose of radiation that is given. It's 0.1 millirads. It's difficult to do the procedure when the thyroid guard is so big, you know. It's like a bib which you have to wear. So if you can wear it and do the mammography, nothing like it. But definitely I will take this point up with Holy Spirit Hospital. I think, sir, we'll have to take this point up.
So for dental problems, if you are doing implants and all, the thyroid guard has not been used.
If you put it is better. If you put it is better. See, all these X-rays are very small dose of X-rays. They don't damage everyone, but 1 in 1,000 or 1 in 10,000 will have a problem. But you can't even pinpoint that has done the X-ray. That X-ray has done the problem. So when it will be after a very long time because it's a slow growing cancer. You will develop probably after 10 years.
I have done my dental implants. It took over 40 sessions in 1 year, but so many things were done. And I don't think the thyroid guard was used. So now I'm a little worried.
Don't be worried. Don't be worried. It's not a very big problem since it has been asked. I usually advise that you should have wear a thyroid guard, but there are many people who would say don't use a thyroid guard. It's not at all preventing thyroid cancer. But yes, any kind of radiation you would try to avoid. If the dentist has a thyroid guard, please use it.
What would microwave, heating food in microwave?
Again, bad. Microwave foods are bad.
Microwave. But putting a cap over the food, I mean, lid cover over the food, can it prevent to some extent?
Difficult to say, sir. I don't have any experience on that. I think we'll have to call someone.
Dr. Dale, can I ask you something?
Yes, please.
Doctor, you have helped us in the past, various, there are various trusts, like helping for chemo expenses for the poor. Can you hear me, doctor?
Yes, I can hear you. I'm waiting for the question.
Yeah, there are various trusts, like helping for, especially for cancer patients for chemo expenses.
Yes.
And we also are struggling, and it's a real battle, like where to go and how to help these poor patients. So in this regards, can you throw some light, doctor?
Every hospital has a social worker, and every social worker, if you approach in a hospital, will help you out, provided you meet the criteria that the hospital or the charity commission has. You'll have to provide your Aadhaar card, PAN card, your income certificate, whatever documents are required for in terms of completion of that social worker's needs or the Charity Commission of India's needs. You'll have to do that, and if you're eligible, yes, you will get the help that you will require.
Okay, doctor. Okay.
Can one control one? Yeah, one question. Yeah, many more. Can one control one's estrogen and progesterone for cancer? Yeah, I'm picking up, doctor. I'm picking up only a few. Can one control one's estrogen and progesterone for cancer prevention?
You can't control your hormone levels. You'll have to just there's no way to control your hormone. That's why we advise pregnancy early, so that your cycles are stopped early for at least a year. Then repeated pregnancies. Repeated pregnancy, you won't advise. At least 2 children, if you have, is good. Can't control your hormone levels.
Is nutrition medicine or prevention for cancer? I guess.
Which medicine? I didn't get you. Sorry.
Is nutrition medicine or prevention for cancer?
Nutrition is basically what I've talked about.
Since there's a question on this, I would like to add another question. This.
Can't hear.
I'm sorry, I'm not able to hear.
What is the PCOD, polycystic ovarian disease?
Can't hear you well.
It's dragging.
It's dragging.
Internet is dragging, yeah. Put it on the chat.
Dr. Giselle, take the next question.
Yeah. Dr. Dale, I would like to know, did you also find that most or many of the cancer patients
what
were
about
diabetic?
PCOD? I mean, polycystic ovarian disease, where there is do these people have cancer issues?
PCOD is not related with it. But PCOD may...
People are sweet people, they hardly get...
Don't make noise, I can't hear them.
PCOD may hamper your cycle. So again, it's a changing hormonal cycles, but there's no direct correlation with breast cancer. or ovarian cancer.
Doctor, is there any connection of diabetes with cancer?
Can you please
Diabetes
repeat
with
the question?
cancer, yes, diabetes has a direct correlation with
No, one
pancreatic
sec.
cancer.
My question, can you please repeat as I have mentioned in my message, please?
I would like to know, did you also find that most or many of the cancer patients were diabetic? So, same as I come across many of my patients with cancer and diabetes, both being a dietitian.
There's only one cancer which has a direct correlation with recent onset diabetes. It is pancreatic cancer. When you say that you are getting a lot of cancer patients with diabetes, I would say it is you are getting a lot of diabetic patients with cancer. Means diabetes is more common than cancer. Diabetes is like the now becoming the number one disease. There's so many people are getting diabetes, but there's no direct correlation other than see a pancreas. And another frequently asked question is that there's no correlation with sugar with cancer. Many people ask me, should I stop my sugar? There's no harm in stopping your sugar, but don't think that by having an ice cream you're going to get cancer again. By having a donut you're going to have cancer again. Once in a while, just enjoy yourself.
Is passive smoking harmful?
Very harmful. Passive smoking is worse than active smoking. Passive smoking means you're ideally smoking in the smoke what has been given out by someone else. So the particles of it are much finer. So that's very bad.
In breast cancer, when you do radiation, does it burn all the cells and does it increase heart risk?
No. Breast cancer screening means mammography. Is that the question?
I guess the radiation that the patient receives after breast cancer, then they're asking whether the heart risk risk would increase.
Radiation nowadays has become very, very, very standard. You have the best of machines to target and avoid the heart area if it's the left breast. So the heart is the problem and it is the left breast to radiate. But radiation and radiation for treating cancer is different from just radiation for a cancer risk factor. So risk factor for cancer is subclinical exposure for radiation. Whereas in treatment per se, radiation, when it is given, it's a full dose. It's a clinical exposure of radiation. We try to burn out the cell.
Yeah.
Yes, doctor, I was talking about radiation for treatment of cancer.
So treatment of cancer radiation is good, means that's a recommended treatment. That's a clinical exposure of radiation. That means direct radiation beams are given on the cancer cells.
Does it increase the risk of heart problem?
No, it doesn't. See, if there are 3-4 types of radiation. Is the standard radiation. There is a IMRT, intensity modulated radiation therapy. There is an image guided radiation therapy, and there is something known as rapid eye. So there are 3-4 types. The higher the version, the better is the chance of scattered radiation beams to the other organs. So when breast is radiated or the cervix is radiated or some other organ is radiated, we are worried about the beams going to the other parts of the body or other organs of the body beside that area. So when you get a higher machine or a higher variant of the machine which will not scatter beams, then the chances of damage to the other organs are very less.
Then a machine and the better quality machine and a good radiologist would be very important in that case.
Good radiologist, good technician. So radiation is not only a thing, it's about making the contouring the beams according to the body part. So it's a local treatment basically.
Thank you, doctor.
Hi, doctor. Good afternoon. Can I just pose a question, please?
Yes.
Yeah. So my dad and my brother both have passed away due to cancer. My dad had lymphoma, and my brother had lung. How prone would I be, or likely would it be that I would develop it?
Anyone else?
I am now 60.
You are 60.
Yes.
So there is something known as genetic screening and a genetic counseling.
Okay.
They will assess your risk score. So lymphomas and lung cancer are two unrelated. They're not related to each other. So it's unlikely
Yes.
that you may have a genetic problem.
Okay.
But if you really want to go into the depth of it, meet a genetic counselor. She will
Okay.
assess your scoring system. If your score is high, then you go in for a hereditary gene panel. That's a blood test. You can get your genes tested.
Okay.
Usually at the age of 60, we don't advise. For a younger age group, say less than 40, yes, and if you have such a history, yes, you should think of doing a hereditary cancer gene panel.
Okay. So can I do it at any pathology, or is it at certain
No, they're
locations?
not done at every hospital. It's like these private labs, gene labs who do it.
Okay.
You can get the numbers over the net, or there are labs which take samples from the hospital. You can contact them. Before meeting a lab, you meet a genetic counselor, because every lab will say, karo test.
Okay.
But you need to really meet a genetic counselor, see if the score system of yours is very high, then only you need to go in for genetic testing.
They come home also to draw the blood, right?
Then they come home. These are expensive tests, so they come home and they'll give you good service. But they're expensive tests. They range from 15,000 to about a lakh and a half.
Oh dear. And another question is, just in case if one does breast cancer and a pap smear cancer test, when is the next one which would be due? Has it to be done continuously for 3 years? That's what I was told.
Not 3 years. You have to continue it forever. It's
No, means I mean to say that you have to do it every year.
Every year
is what I'm
that is
asking.
the recommendation. Yes.
Every year, right?
Every year after the age of 40, once a year you should do it. Is a recommendation by US. In India, we follow 45 years and 50 years above every year.
Okay. Thank you very much, doctor.
Welcome.
Excuse me, doctor. You said that every year, but up till what age is that required? 65, 70, I mean.
70 is fine. There's no recommended stopping age. Everyone talks about the starting age, but 75 is fine. The usual cancers of breast cancer we see between the age group of 60 to 70. 60 to 70. So that should be, see, why we advise after 45 years is we want that 10 years gap or precursor lesion to be picked up. That is a microcalcification. The starting point. If you're picked up in that group, you are just going to need surgery. You're not going to need chemotherapy. You're not going to require radiation. So that's the criteria of why we advise 40 to 45 years. You start your mammographies after every year.
Doctor, can I ask a question, please?
Yes, doctor.
If my CBC and other general blood tests are clear, can I be relatively sure that I do not have any sort of cancer, or only specific cancer tests will show presence of cancer?
So CBC is not going to show anything. CBC will just show that your blood hemoglobin is normal, your blood count is normal, and your platelet count is normal.
Okay.
Other blood tests, when you say specifically, if you do tumor markers, as I said before, ovarian cancer has a tumor marker, CA125, then CEA is for colon, CA99 is for pancreas. Various tumors have various markers, and some cancers do not have markers. So even if you do a full body screening with all the markers and all, still you have not, still the risk of you having a cancer may be there.
Except
Doctor,
leukemia.
are chocolates bad for cancer?
Sorry, I didn't get you.
Are chocolates bad for cancer?
Chocolates are good.
Because they say that the cancer cells thrive on sweet.
So as I said before, sugar is not a direct correlation with cancer. Sugar direct correlation with cancer is only on WhatsApp. So avoid that. Sugar is okay. But if you want to avoid sugar, there's no harm in avoiding sugar.
Yes, doctor. Thank you.
Doctor, how many times in a life can one do a PET scan?
How many times in life?
Yeah.
See, I usually do a one PET scan before the surgery if someone is detected with cancer. So PET scan is the only advice when you have cancer or you want to screen for cancer, not as a routine for screening, but post surgery. And post surgery, I advise every 6 months or maybe first 2 years. Once 2 years are crossed, then the lesser chance of cancers coming back. But there's no recommendation or criteria how many PET scans can you do. Usually I don't advise a PET scan before an interval of 6 months at least. No, just because that the PET scan is something as a radioactive dye which has been given to you. It's a radioactive dye, so you don't want that radioactive material going into your body every now and then. So 6 months is a good enough time period to get a second PET scan. But n number of PET scans can be done. It's not that it cannot. There's a number to it.
Does it have any negative impact on your body cells?
No,
Active?
it's a very small dose.
Okay.
Very small dose. Before you can exit the diagnostic center, the dye is already out of your body.
Okay. Thank you, doctor.
Welcome.
Doctor, if in breast cancer, if it's already stuck on one breast, how likely is it to get affected on the second one?
So you fall under the high risk group. So once you've developed on one side, then you're obviously being told by the oncologist that please get your mammographies done every year. So there is a higher risk, but if you are on a good follow-up, having a mammographies every year, you will be picked up at an early stage, and it can be treated early.
What is the percentage he's asking?
A high risk group.
What is the percentage?
Percentage of it coming on the opposite side, I would say about 20%. We don't see it that common. But yes, there are people who come back with opposite side. Not only opposite side, I have seen patients with breast cancer and then having a colon cancer. We did a PET scan after 6 months, and 6 months later we developed a colon cancer. I have a patient who is just right now under me who had a colon cancer 6 months back. We've done a PET scan right now, and the PET scan is showing a cancer in the stomach. So two different unrelated cancers, stomach and colon, never known to be related, but things happen.
So one can develop two different types of cancer at a time.
Oh, I've seen 3 cancers in one patient also.
Oh.
It's not common, but it happens. 2 cancers are quite common. Means I've seen many patients with 2 cancers together.
Okay. Thanks, doctor.
One last question, doctor. There's Varsha has asked a question. So many of us have IBS gas, stomach gas. What can we do to ensure that we don't have stomach cancer? Would you recommend any test screening, age 70 years? Thank you.
IBS is nothing to do with stomach. It is something to do with your small intestine. So it's something to do with the ileum and the jejunum. Irritable bowel syndrome. It's not a precancerous condition. Treatment for it will be probably just symptomatic treatment only. Avoid all those foods which will cause the bowel syndrome. You will probably need to see a gastroenterologist for that.
So, doctor, is there any particular signs which will show for the various cancers of the stomach?
Stomach cancer is an aggressive cancer. It may start with just a simple acidity, stomach pain. When it is a big stomach mass, it's too late already actually for stomach cancer. When you can feel it from outside, it's ideally already very advanced. So in Japan, they do, since their stomach cancer cases are so common, they do screening on a very regular basis for people with acidity. Means they do endoscopic screening, that is a gastroscopy, and pick up things. But in India, per se, we don't have that thing of doing a regular screening for stomach cancer. If there is a persistent acidity or acidity not being relieved for a very long time, say about a month and a half, then come to a gastroenterologist, let them do a gastroscopy. If the gastroscopy is showing anything evident, then we should get it tested.
In America, they advise elderly people after 50 to do colonoscopy every year. What is your take on that?
See, we can't compare ourselves, sir, with US. They have strict policies there for screening. In India, we can't do that because one is people don't like doing screening programs. Second thing is that if you do it, there's a cost factor. In US, most of the people who do it are covered under insurance. So it's a big question mark. Of course, these things are advised by us that do screening after the age of 50 for colonoscopy. And especially if you have a colon cancer relative already in the family, you should start 10 years prior to the age of what he had it. So if he had it at 50 years, you should start at 40 years. So 10 years prior, you should start the screening. But not at all, it's not practical in India as of now. But these things will have to be put in place one day or the other.
So that's it. Dr. Giselle, if there are no questions, can you give the vote of thanks?
Doctor, excuse me.
Yes.
Doctor, can I have a quick look at the pics of the take-home messages?
I'll do one thing. I'll send the whole PowerPoint to Dr. Giselle. She'll forward it to everyone. You can do
Yeah.
it, Giselle?
Yeah. Sharon, will ask Sharon to do that.
All right.
Okay.
All right.
Yeah. Okay. Good afternoon. Now it's already afternoon. And it's really an honor to be chosen to say this vote of thanks. I quote, silent gratitude isn't very much used to anyone. And I choose not to be silent. Today's topic, Dr. Dale, is very special. And I want to thank you for imparting of your knowledge, your time, your resources. Your presentation was really informative and thought-provoking. We are enriched. Prevention is definitely better than cure, and especially in the case of cancer. We thank you for all that we learned from you today. I'm sure all have benefited from these pointers of exercise, diet, and early screening. We need to catch cancer early. I would like to thank our dear Dr. Atta, whose immense knowledge and experience was evident in the way he moderated the webinar. Thank you, dear participants, for giving of your time this beautiful Sunday morning. We, the organizers, thank you for your interest and commitment to learning more about cancer. Your questions, your comments, your feedback, this all has enriched our discussions and inspired us to continue working towards improving cancer care. I would like to acknowledge all the cancer patients, the survivors, their families, who inspire us with their strength, courage, and resilience in the face of this disease. You are the reason we do what we do. And I can never thank Sharon enough. She's the person behind the scenes, a blessing to us. Thank you, Sharon, for helping organize this seminar. And thank everybody else who made this seminar possible. We hope that you found it informative, inspiring, and worthwhile. Let us continue to work together towards a world without cancer. We have a lovely afternoon with your family. The attendance was really very great today, and we hope all of you all benefited. Till we meet again. Thank you.
Thank you, Dr.
Thank you,
Giselle.
Sharon.
Thank you, Giselle. Thank you.
Wonderful vote of
Thank you, Dr.
Thank you.
Dale,
Thank you,
Dale.
doctors.
Sharon,
Bye.
Thank you,
Dr.
Sharon.
Anta,
And thank you,
Dr.
Sharon, and all
Giselle,
of
and
you all.
every.
Thanks to Sharon. Yes, everybody. Thank you.